Rubella virus.
What is rubella?
The name rubella is derived from Latin, meaning little red. Rubella was initially considered to be a variant of measles or scarlet fever.
It was not until 1814 that it was first described as a separate disease in German medical literature, hence the common name German measles. Rubella is caused by a virus that's passed from person to person. It can spread when an infected person coughs or sneezes.
It can also spread by direct contact with infected mucus from the nose and throat.
It can also be passed on from pregnant women to their unborn children through the bloodstream.
What are the signs and symptoms of rubella virus?
In children, rubella is usually mild, with few noticeable symptoms.
For children who don't have symptoms, a red rash is typically the first sign. The rash generally first appears on the face and then spreads to the rest of the body and lasts about 3 days.
Other symptoms that may occur 1 to 5 days before the rash appears include a low-grade fever, headache, mild pink eye redness or swelling of the white of the eye, general discomfort, swollen and enlarged lymph nodes, cough, runny nose. Most adults who get rubella usually have a mild illness with low-grade fever, sore throat, and a rash that starts on the face and spreads to the rest of the body. Some adults may also have a headache, pink eye, and general discomfort before the rash appears. About 25 to 50% of people infected with rubella will not experience any symptoms.
Diagnostic procedures for rubella virus.
Healthcare providers usually confirm rubella with the help of lab tests. You may have a virus culture or a blood test, which can detect the presence of different types of rubella antibodies in your blood. These antibodies show whether you've had a recent or past infection or a rubella vaccine. Treatment for rubella virus. It's a virus, so antibiotics won't work. There's no treatment shortens the course of rubella infection, and symptoms don't usually need to be treated because they're often mild. However, healthcare providers usually recommend isolation from others, especially from pregnant women during the infectious period.
Isolate from others as soon as rubella is suspected and until at least 7 days after the rash disappears.
Current trends: elimination of rubella and congenital rubella syndrome. The administration of more than 123 million doses of rubella vaccine since 1969. The year of licensure has successfully prevented epidemics of rubella and congenital rubella syndrome (CRS) from occurring in the United States. Reported cases of rubella and CRS area all-time lows.
The provisional 1984 totals for rubella case stand confirmed and compatible cases of Crucier 745 and 2, respectively. Compared to pre-vaccine years, the number of reported rubella cases has decreased 98.7% overall, with 90% or higher declines recorded for alleged groups. Similarly, the number of reported confirmed and compatible CRS cases has declined by 97.1% since 1970, the year the highest number of such cases was reported, although there is believed to be a reporting of both rubella and CRS. These figures represent considerable progress.
Nursing management.
Isolation.
Patients will need to be on isolation precautions to decrease transmission within the community.
Emphasize the need for immediate isolation when early catarrhal symptoms appear.
Skincare.
Measles causes extreme pruritus.
Nursing interventions include keeping the patient's nails short, encourage long pants and sleeves to prevent scratching, keeping skin moist with healthcare provider recommended lotions, and avoiding sunlight and heat. Eye care. Treat conjunctivitis with warm saline when removing eye secretions and encourage patient not to rub eyes.
Protect the eyes from the glare of strong light. Hydration.
Encourage oral hydration. Medical literature encourages the use of oral rehydration solution. Temperature control.
Antipyretics should be administered to the patient as ordered for a temperature greater than 100.4 Fahrenheit unless directed elsewise by a healthcare provider. Be sure to remind parents not to administer aspirin due to the risk of Ray's syndrome. Pregnant people with rubella may be treated with acetaminophen to relieve their symptom start in more serious cases. Treatment may include blood transfusion or steroids. Check the vaccination history of the patient. If he/she has not been vaccinated with MMR vaccine, post-exposure vaccine may be given.
Provide a tepid sponge bath for a patient who has hypothermia to facilitate the body in cooling down and provide comfort.
Elevate the head of the bed. Head elevation helps improve the expansion of the lungs. enabling the patient to breathe more effectively. Teach the patient how to perform hand hygiene, covering the mouth when coughing, and oral care.
Here is a short video that will help you better understand the rubella virus.
Why is the MMR vaccine important for you and your family? Measles makes you feel miserable with fever, cough, runny nose and red eyes and red spots all over your body. Sometimes people, especially babies, get really sick with breathing problems and fits. At the moment, there are countries in Europe, including the United Kingdom and Republic of Ireland, where measles is spreading widely. This is called an outbreak, and sadly, some children and adults have died. You're at greatest risk if you have not received 2 doses of the measles, mumps and rubella vaccine. In Northern Ireland, all babies and young children are offered the vaccine for free at 12 months and again at 3 years and 4 months old. Measles spreads easily when people cough or sneeze. If you come into contact with measles and have not been protected against it, it is very likely that you will become sick. The MMR vaccine works to protect you and your family from getting measles, as well as mumps and rubella. Over the last 40 years, more than 500 million doses of MMR vaccine have been given in over 100 countries, so we know it is really safe. Most people will have no side effects. A small number may have redness and swelling from the injection, or a temperature, which usually settles in a few days. Other children and young adults, especially all women planning a pregnancy who have not had 2 doses of the MMR vaccine, should speak to their GP. This is especially important before travelling to countries that may have outbreaks. Protect yourself and your family with the MMR vaccine.